Have you ever wondered how a tiny invisible virus can bring the whole world to its knees? Picture this, the year is 1918, a time when medical science was still in its infancy, and the world was in the throes of the Great War. In the midst of this global turmoil, a deadly adversary emerged, one that could not be seen with the naked eye, the Spanish flu. This virus, as invisible as it was lethal, would soon prove to be one of the deadliest pandemics in human history. It did not discriminate, affecting people of all ages and from all walks of life. The Spanish flu was not a product of Spain, as its name might suggest. In fact, its origins remain a mystery, even to this day. What we do know is that it spread rapidly, its reach extending to the farthest corners of the globe. This was a time when medical advancements were scarce. There were no effective vaccines or antiviral drugs to treat this flu. People could only rely on isolation, quarantine, good personal hygiene, disinfectants, and limited public gatherings, strategies eerily similar to what we have seen in recent times. Adding fuel to the fire, World War I played a significant role in exacerbating the situation. With millions of soldiers living in close quarters and traveling across the globe, the virus found a perfect breeding ground. The war also diverted crucial resources away from health services, leaving communities vulnerable to the onslaught of the virus. The world was reeling from the effects of a war that had ravaged nations and torn families apart. Amidst this chaos and devastation, an unseen enemy was silently spreading. Unbeknownst to mankind, this invisible adversary was preparing to launch an attack far deadlier than any war. As the world was grappling with the aftermath of a devastating war, an unseen enemy was preparing to launch its deadly attack. And so, the stage was set for one of the deadliest pandemics in human history. Little did we know, the worst was yet to come. Imagine a disease so lethal that it could wipe out entire families within a week. As the year 1918 unfolded, the world found itself in the grips of such a malady. The Spanish flu pandemic was reaching its devastating peak. Hospitals were overwhelmed, doctors were stretched thin, and the sheer scale of the outbreak was staggering. This was no ordinary flu, its symptoms were alarmingly severe. The afflicted would initially experience the usual signs of influenza, fever, aches, and fatigue. But soon, they would develop a bluish hue to their faces, a chilling indication of the severe respiratory distress the virus caused. The sickest would cough up blood, their lungs filled with a frothy pink fluid. In the worst cases, death would follow within hours. What set the Spanish flu apart from other influenza viruses was its unusual victim demographic. Typically, influenza poses the greatest risk to the very young, the very old, and those with weakened immune systems, but this virus was different. It targeted young, healthy adults, those in the prime of their lives, which was a chilling departure from the norm. The mortality rate was staggering. Tens of millions of lives were lost worldwide, with death tolls highest among those aged 20 to 40. In some places, the virus wiped out entire families, leaving towns and villages eerily deserted. In the United States alone, more than 600,000 people succumbed to the virus, a number greater than the country's total losses in World War I, World War II, the Korean War, and the Vietnam War combined. Every corner of the globe was touched by this invisible enemy. From the bustling cities of Europe to remote Pacific islands, no community was spared. In the blink of an eye, the world was facing a health crisis of unprecedented proportions. The Spanish flu pandemic served as a stark reminder of our vulnerability to the microscopic world around us, a world that, despite our best efforts, we are still struggling to fully understand and control. In the face of such a deadly enemy, the human spirit refused to be defeated. This statement rings true as we delve into the battle against the Spanish flu, a battle fought not on the fields with weapons, but within the confines of hospitals and homes, armed with nothing more than determination and the will to survive. As the Spanish flu swept across the globe, communities quickly realized the importance of taking preventative measures. Quarantines were enforced, with the sick being isolated from the healthy in a desperate attempt to curb the spread of this unseen enemy. The streets became a sea of masks, as people covered their faces in hopes of protecting themselves and their loved ones. Yet these efforts were met with mixed success as the virus continued its relentless march. In the absence of an effective vaccine or antiviral drug, makeshift hospitals became a common sight. Schools, churches, and other public spaces were transformed into care centers, where the sick were treated with what little medical knowledge was available at the time. Doctors, nurses, and volunteers worked tirelessly, often at great risk to their own health, providing whatever care they could. Yet, despite their best efforts, the Spanish flu continued to claim lives. The lack of understanding about the virus, coupled with the absence of modern medical advancements, made it a formidable adversary. The world was in the throes of a health crisis unlike any it had ever seen, a crisis that was testing the limits of human resilience. It was a terrifying time, a time of uncertainty and fear. But through it all, the human spirit refused to be defeated. People banded together, helping each other in whatever way they could, showing a strength and resolve that was truly inspiring. And so, the battle against the Spanish flu raged on, a battle against an enemy that was as invisible as it was deadly. It was a fight for survival, a fight that would test the very fabric of society. The world was in a race against time, fighting an enemy they could not see. And even though the odds seemed insurmountable, humanity refused to give up. This was a battle they were determined to win. Opening. The Spanish flu left behind a world forever changed. In the quiet aftermath of the Spanish flu, the world grappled with an unimaginable loss. The pandemic claimed the lives of approximately 50 million individuals worldwide, a death toll that surpasses the total casualties of the First World War. Each death left a void, a ripple of grief that touched families, communities, and nations. For those who survived, the road to recovery was often long and arduous. Many were left with lingering health effects such as fatigue, neurological complications, and heart conditions. These post-influenza syndromes served as harsh reminders of the virus's ruthlessness, affecting people's quality of life and their ability to contribute to society. The pandemic didn't just leave its mark on individuals, it also triggered widespread social change. Communities became more vigilant about public health, understanding the importance of quarantine measures, personal hygiene, and disease surveillance. The Spanish flu was a harsh lesson in our vulnerability and the need for global cooperation in health matters. The economic impact was equally profound. With a significant fraction of the world's population sick or in mourning, productivity plummeted. Industries across the board were hit hard, from agriculture to manufacturing, leading to an economic downturn that took years to recover from. The world of science and medicine was forever altered as well. The Spanish flu prompted a surge of research into infectious diseases, leading to advancements in vaccines, treatments, and public health infrastructure. It served as a stark reminder of the importance of scientific research and the need for continual investment in health and science. The pandemic also reshaped the way we view our societal structures. It highlighted the stark inequalities in access to healthcare and the devastating effects of these disparities. This triggered conversations and actions aimed at improving healthcare access and delivery for all. Closing. The Spanish flu had come and gone, but its impact would be felt for generations to come. The pandemic was a turning point in our history, a tragic event that prompted a reevaluation of our priorities, our values, and our approach to health and well-being. Its echoes can still be heard in our policies, our research, and our collective memory. So, what lessons did the world learn from the Spanish flu pandemic? The Spanish flu, a cataclysm that engulfed the world in 1918, was a devastating but profoundly transformative event for global health and medical research. It served as a wake-up call, prompting a seismic shift in our understanding and management of infectious diseases. In the aftermath of the pandemic, the world witnessed a surge in the field of epidemiology. The Spanish flu, in its grim way, laid bare the need for a systematic study of disease patterns, causes, and effects. It sparked a renewed interest in studying how diseases spread, who they affect, and why. This new focus gave birth to more sophisticated methods of disease tracking and control, leading to the development of modern epidemiology. The pandemic also led to significant advancements in public health policies. Before 1918, public health was often relegated to the periphery of policy decisions. However, the Spanish flu changed that, thrusting public health into the spotlight. It became clear that the health of the individual and the health of the community were inextricably linked. Consequently, nations worldwide began to prioritize public health, investing in healthcare infrastructure, sanitation, and disease prevention programs. Moreover, the Spanish flu highlighted the importance of international cooperation in tackling global health crises. It underscored the need for a collective response, leading to the establishment of international health bodies, such as the World Health Organization, dedicated to monitoring and responding to health emergencies. The Spanish flu also spurred advancements in vaccine research. The desperate search for a cure during the pandemic set the stage for the development of flu vaccines, which have since saved countless lives. The Spanish flu pandemic was a tragedy of unparalleled proportions, But it also served as a stark reminder of the importance of global health and preparedness. It taught us that public health is not just about treating illnesses, but also about preventing them. It is about vigilance, readiness, and the courage to confront the unseen enemy. And most importantly, it reminded us that in the face of a pandemic, we are all in this together.